My name's Semi Kadak, and I'm a pelvic health physiotherapist, and I also fit pessaries for women to help with prolapse or stress incontinence. So I wanted to tell you all about pessaries today and how they can be helpful. And I have a collection of a few different styles and sizes that we can have a look at and talk about how they can be helpful in different ways. Pessaries are often used as a way of providing structural support to the tissues of the vagina, so the vaginal walls and the pelvic organs. And then there are some that also provide some extra support right behind the urethra to help with stress incontinence. So I'm going to show you a few different ones. And as somebody who has used a pessary and has found it really helpful, I'm a big advocate for them. I think it's always worth a try. If you've done all the strengthening, you've got all the lifestyle habits in place, a pessary is not necessarily going to resolve prolapse or make the structures go back to where they were before, but they can be hugely helpful in relieving sensation of irritation around the vagina from things sitting a little bit lower. It can help to relieve pressure or heaviness within the vagina. It can help to actually bring inside the bulge. If things are protruding, then it can help to keep those tissues inside where they're supposed to be, which in turn keeps those tissues healthier. Sometimes prolapse can be associated with difficulty fully emptying your bladder or fully emptying your bowels. And if we're able to provide that lift and bit of structural support to get those pelvic organs back aligned where they ideally should be, then things are going to empty and clear out much better. So less urinary retention and less constipation. The pessary can also be used to provide some really specific support right behind the urethra. So for example, these two that have this extra thickening on them, this one's called an incontinence dish, and this one is called a ring with a knob. And so as it goes into the vagina, this thickening sits right behind the urethra and helps to provide that little extra compression where there should be some supportive connective tissue. And it just gives women a much greater chance of fully closing the urethra and not having that bladder leakage in cases of increased abdominal pressure. So scenarios like sneezing, coughing, laughing, lifting something heavy, or during exercise or higher impact activities. So the type of pessary you might use really depends on the structure that is starting to sit a bit lower within the vagina, whether it's the bladder, the uterus, or the bowel. These more circular shaped pessaries, so this is called a ring pessary, and the dish would have that similar shape support. They help to provide the best support for the bladder and the uterus, but they don't necessarily do a lot for the back wall. Sometimes though, I do see an improvement in the support and lift of the back wall just by the fact of this pessary taking up a little bit of the slack and helping to elongate the tissues in the vagina again, rather than letting them sit lower. But the one that tends to provide the most structural support that I commonly use would be a cube. So this one's just blue because it's one of the tester ones. Often the ones that people purchase to take home will be white. These are all tester ones. So the cube is what we call a space occupying pessary, and it would go inside the vagina and literally take up the space within the vagina to provide support to the front wall, the back wall, and to the uterus and cervix as well. The nice thing about the cube pessary is it does have the ability to provide a little bit of suction to keep it in a good position, whereas the more ring-shaped pessaries do require a certain amount of strength and tone through the pelvic floor muscles to help keep them in place and not slip out. So there's lots of considerations that we take into account when we are assessing somebody for the style and size of pessary that they might use, including the dimensions of the vagina, the type of prolapse, as I mentioned, the strength of the pelvic floor muscles, and then really what is the most comfortable for somebody to use. So the nice thing about pessaries, if we find one that's a good fit and it's providing the support that we like, Most of the time, you shouldn't feel it when it's inside the vagina, kind of like a tampon. When it's in a good place and it's not, in the process of entering or exiting, you actually don't notice it at all. So a lot of women are surprised because they can be a decent size, but the vagina has a lot of sensory nerves around the entrance of the vagina, so within the first inch or so. Once it gets beyond that point, and once it stops moving and it's not putting pressure specifically on the muscles, you tend not to feel it at all. So that's nice. You don't feel it, but you can often feel the relief that is provided by taking off the pressure of things sitting lower in the vaginal canal. Considerations for being able to use a pessary: we do assess the health of the vaginal tissues within our scope of practice, but we do like to have you check with your family doctor and have an actual tissue health exam to make sure that the vaginal tissues are healthy and we're not going to cause any irritation by using a pessary. For some of my ladies, that might mean introducing the use of some vaginal estrogen, especially if you are in a lower estrogen state. So either early postpartum or postmenopause, where the tissues can just be a little bit more delicate and fragile, and we don't want to cause any injury to those tissues internally by using a pessary without making sure that the tissues are healthy and robust. Potentially using a vaginal moisturizer can help. And then the vaginal estrogen for some women can be really needed as well. The side effects that you might experience using a pessary include a bit of an increase in vaginal discharge and maybe a change in smell. That's pretty normal. That's just the vagina's way of recognizing there's something foreign in there, and it's just trying to help flush and keep things clean. And it's not a sign that there's anything wrong. However, just the fact that there is a pessary in there does increase the risk of a bit of a flora imbalance. So women can be more prone to yeast infections or bacterial infections by using a pessary, which is why we are very diligent with making sure that you're taking it out at appropriate intervals, giving it a good wash, and then reinserting it. I find that things tend to go a little bit more askew in terms of vaginal pH or vaginal flora the longer that it's left in. So removing at regular intervals, which might mean for some women they like to take it out every night. Other people will leave theirs in for a few days at a time or for a week or two at a time. Some pessaries can actually be left in for quite a while as long as it's working for their bodies and not causing any negative side effects. So the upsides of the pessary: they provide support, they generally feel pretty comfortable if we get a good fit and if the vaginal tissues are healthy. The improvement in your symptoms can be pretty much instantaneous. Honestly, I have women who come in and they might have fairly significant sensation of heaviness or bulging in the vagina, or they feel like they're sitting on a golf ball whenever they sit in a chair. And then if they leave wearing a pessary, they feel like everything's back to where it should be and they feel so much more comfortable. Similarly, with the ones that help with stress incontinence, I might have someone who walks in and she's leaking every time that she coughs or every time that she plays her sport or goes running. And then if she leaves with one of these, with that extra urethral support, she's able to just enjoy and not worry about leaking during those activities. So I'm a big advocate for them if it's something that feels comfortable for you to try.